Duchenne muscle dystrophy is a muscle disorder, which is an X-linked recessive disorder and has an incidence of 1 in 5,200 boys. Recessive means it presents in boys and is passed down to the girls, who will be carriers. The defective gene on this X chromosome is known as the dystrophin gene and has a defect on the dystrophin protein. From a pathological perspective, it's on the largest gene, which is on the largest chromosome, as in chromosome 1. Now this is located on the sarcomere protein, which facilitates calcium that enters and interlinks actin and myosin so that the muscles contract. A decrease in the dystrophin gene means a decrease in calcium and a decrease in contraction, which results in muscle that is weaker. The clinical symptoms become prominent by age 4 or 5, when the child seems to have difficulty running, jumping, and hopping. Now, because of this muscle weakness and muscle dystrophy, they end up having weak hips that are shown bilaterally, and they also have weak neck muscles. These two are the most prominent ones when looking for clinical features. So kids with these tend to sway as they walk because the normally perpendicular hip pelvis now has a drop due to the weak muscles. This is known as the Waddling Gap. The other clinical finding is known as Gower's sign. This is when the child has difficulty standing up from a sitting position and they have to use a lot of arm and leg support to actually stand up. This disease is only prevalent in boys. Gower's sign is also seen in females, but in dermatomyositis. One other clinical sign you see is in the child's calf muscles. They are extramuscular and is known as pseudohypertrophy. This is due to the fat deficit that accumulates in there. So when you touch it, it actually feels like a fat padding. This type of disease progresses quite fast, and by 12 years the kid is wheelchair bound. They end up having progressive scoliosis that ends up with more lung impairment. So the most common cause of death is usually due to chronic heart failure or pneumonia. So the first workup that you do for suspected cases of Duchenne muscle dystrophy is to check for their serum Cpk levels. Now there are 3 types. The one found in skeletal muscle is Cpk-MM, whereas in myocardial infarction we look for the Cpk type MB. The serum Cpk levels would be about 20 to 100 times more elevated till 4 years. By the ages of 10 to 12, they become normal, and after 15 years it decreases. So this is not really an ideal investigation of choice, but is used more as a screening method. The investigation of choice to make the proper diagnosis for this disease is to do with a PCR for a dystrophin gene. This is usually treated with prednisone and is not really a definitive treatment, but mostly to slow the progression of Duchenne dystrophy. Other than that, aggressive chest physiotherapy is recommended so the incidence of pneumonia is reduced. Another variant of this disease is known as Becker's muscle dystrophy. This is also seen in boys and is quite similar to Duchenne's, but essentially is milder. It presents at 10 years of age instead of at 4, and the patient is usually wheelchair bound by the age of 25. Patients with Becker muscle dystrophy live a longer life and they usually die at around 40 years of age. Treatment is essentially the same. And that's the end of Duchenne muscle dystrophy discussion. Thank you for watching.